Welcome back to another PT Pro from the Optimal Body Podcast. I'm Dr. Dom.
I'm Doc Jen.
And today we're going to be talking about tennis elbow, one of those pains in the elbows that you might get if you're doing a lot of work with your hands, why it happens, what you can do about it. Stay tuned.
Welcome back to another episode. Today we are talking about tennis elbow, or formerly known as lateral epicondylitis. So is it an itis? What is it? We're going to talk about all of the things.
And this is like really common mostly because, if you think on the outside of your elbow, if you kind of reach on the outside of your elbow and have this little knobby part right there, there's like a whole buttload of muscles that come off that. Yeah, that's what they teach you in PT school. A buttload of them. There's like 5 that specifically connect into this common thing called the extensor mass. So if you cock your wrist back, like you're going to shoot a basketball or something, you can feel that kind of flex. You can feel those muscles activate. There's 5 different muscles that contribute to that, even more, but 5 specifically that attach right into the lateral epicondyle, which is that bump right out there.
Formerly, it was called lateral epicondylitis, actually in 1873.
First person who started to say, hey, people are having elbow pain out here.
Right,
Let's call it something.
But we thought it was an inflammatory process. And I think a lot of people still think of it as an inflammatory process. But we talked about this in the tendinitis versus tendinosis or tendinopathy, whatever that podcast label was. We talked about it in that tendon episode because it's actually not about having an itis. It's not an inflammatory process by the time you're feeling it anymore. It's really just now a tendinopathy. There's some degeneration happening at those extensors that connect right into that elbow.
Yeah, we also talked about this in the plantar fascia episode or about plantar fasciitis and the Achilles tendinitis episode that we had. Just because a lot of these things, at one point you have an acute time where it's inflamed or where there's extra inflammation in there. But again, generally these areas that have these really thick tendons, it takes quite a bit to get them disorganized enough. That's literally what happens after we have that inflammation chronically over time, or we keep overusing this area. Then our body just lays down all these random different fibers and collagen fibers, and what we see is a lot of just dysregulation of the tendon in the area. And that's what kind of causes this, just like, okay, now it's not quite feeling good chronically when I use it.
Now, as I'm doing the motion, whether it is playing tennis or doing manual work or typing a lot or is anything repetitive that you're doing with the arm in the same exact motion, now that every time I do it, now I'm starting to feel the pain. First, we're just going to dive into the nerdiness of what actually connects up in there.
Some anatomy. Do you know all 5 of them? So the most common one, because I just looked so I can remember it, is the extensor carpi radialis brevis. And so if you're sitting with your palm down towards the ground and you kind of cock your wrist back up towards you and then towards the thumb side, which is the radial side. Basically, all that's meeting is the extensor carpi, it goes to the wrist, radialis on the radial side, meaning towards your thumb, brevis, it's the shorter one. And there is a extensor carpi radialis longus, which guess what? It's just a little bit longer than the brevis.
And we go over these muscles so that now you have some familiarity in case a doctor is talking to you about it or a physical therapist. But in actuality, you don't need to know the breakdown of all these different tendons that are connecting into the same area and causing this degeneration at that tendon. It's really not about, specifically what tendon is affected and what muscle is it coming from. Well, it's a group of 5 muscles kind of connecting right into this tendon area.
And they like to say, that ECRB, the extensor carpi radialis brevis, is the one that's primarily responsible. No, it's probably just the one that's getting overused the most or to the highest degree. So the whole system's out of balance.
Right, exactly. So if you're doing that kind of movement, are you doing something that bends the wrist back and kind of goes up toward the thumb? Like, what are you doing all the time that could be in that motion? Then you're using that muscle. But we also have the supinator. We also have the extensor digitorum. We have the extensor digiti minimi. And we have the extensor carpi ulnaris. And those are all, what do they start with?
extensor. So they all go into that extensor mass.
Except the supinator, which just takes that hand and it puts it upright.
Supinates, like it makes a cup of soup.
Holding soup.
It's all these funky little words that basically mean those muscles extend your wrist and, and your fingers, right?
When we're talking about like overloading a tendon, there's ways that we can load the tendon aggressively and repetitively, but we have to do it in a progressed way. And if it's not done in that progression where your tendon can handle the load that you're providing it over and over again, then of course there's going to be some breakdown. It's like going to lift all of a sudden the super heavy weight that your body's not ready for. So think of it in that way. It's just like you've come to this point where you've overdid it within your body a little bit. So now what do we do once we've kind of past that point and we're having pain? That's what we're talking about. And the pain that we're talking about, and it could be a little bit like a little higher, it could be a little bit lower. It's just that on that outside of that elbow, it can radiate down into those extensors. So again, the back of that forearm that kind of lifts that wrist joint up.
So some people might notice like, oh, when my hand's open and I'm extending my wrist, I notice it more kind of into the top of my hand or into my wrist versus, just being isolated right around that elbow.
Right. And then when we talk about the specific test that we're doing, all we're saying is like, here's a test that reproduces your pain.
Thompson's test, that's basically just putting your hand back into extension and then trying to resist and push it down. Mm-hmm. And if you feel that pain come in around your lateral epicondyle or that little knobby thing on the outside of your elbow,
you have tennis elbow.
Told
me all the stuff. Now tell me what I can do about it. Can I just go get an injection? Should I just get a shot? Do I need surgery? How do I actually start to heal this?
Okay, if we're talking research-based, what we saw that works well is eccentrics, which is basically meaning from a shortened position, so with your wrist extended back towards your forearm, cocked back towards the forearm, loading it and then slowly allowing it to go into flexion. Because what we're doing...
So you're resisting as you're allowing that to go down.
Totally. Or if you had a little dumbbell, like having it in your hand and slowly going down towards the ground. And that does a couple different things. When we're doing eccentrics, our muscle is actually able to take the most load. So that's a great way to be able to load the tendon and the muscles up where you couldn't, like if you're doing a bicep curl, you might not be able to get the weight up to the top of the bicep curl, but you could put the weight in your hand and control it on the way down. And that's a great way to kind of, what we said at the beginning, reorganize these tendons and these fibers, because it causes all these little micro, changes in the tendon that then our body needs to repair. Mm-hmm. And we get more of those changes when we do eccentrics.
And when we load it. In a progressive and slow way, right? Yeah. So it's not just like, oh, let me get a big weight and put it in my hand and then try to fight against it.
Yeah.
That's probably a little too much. So you can always even start with like a TheraBand. You can start with your own hand. You can start with isometrics. So even just starting of like, oh, where can I go that I can tolerate and it doesn't hurt a whole lot? Like you don't want to also be in pain when you're doing this. You might feel like a little moderate pain, but if it goes away after, great. You can keep pushing into that a little bit.
The first step is always to just explore the full active range of motion, active and passive range of motion. So before we do the loading, before we do the eccentrics, I should have brought up like, can you just get into full flexion with your fingers down towards the front of your wrist? And then maybe put a little overpressure. And how does that feel up towards the elbow? Then how far can you actively extend? And then push a little more into extension. Once we do that and you're able to comfortably do that, then moving into some of these things like isometrically just holding and trying to resist, or moving into eccentrics would kind of be the next step.
And we talked about it before too. The first load on a tendon is a stretch.
Yeah.
So if we were to fully extend the arm and then bend the wrist down into flexion, that's actually getting a stretch of those tendons right there. Mm-hmm. And so if that's a little painful, I would start with the hand. So you're not like on a surface or anything.
Or like on the ground. A lot of people like to do it in like a hands and knees position on the backs of their wrists, which can be pretty aggressive if you're feeling something like this.
Exactly. So just starting with your elbow extended and then using your hand to kind of guide and making sure that you keep the elbow straight and do it. And you're not resisting. This is a passive stretch and you're just holding. And I would start with that and then getting into exploring the active range and then getting into, okay, now can I use a band and hold on to a band and then slowly let my wrist kind of fall into flexion.
Well, what about rubbing it? Like that feels good for me. Like that feels good when I rub into it myself, or like I go in and have your sister.
And she was like, my elbow's been hurting. Can you just rub it? And I was like, I mean, I can, but I'll give you exercises, but just rub it, please. It just feels better when you rub it. And I'm like, oh.
Yeah, this episode's for you, Natalie. But those things help because, again, we've talked about some of these things in previous podcasts. It helps with the immediate pain. It helps kind of block pain signals to our brain and send a little bit different messages through this kind of mechanical gating. It can promote different blood flow to the area. So again, a lot of people will use these techniques. I remember one guy, I gave the exercises and he's just like, yeah, but it feels so good to do this stuff. So then I kind of like talked him through some different like myofascial techniques, or like, hey, just take the back end of like a spatula or a tool that's a little bit rounded that you can,
which we did do an episode on scraping.
Totally, that you can work into, and then do some of those eccentrics or those exercises, because then again, we're even giving more stimulation into that area to promote the proper healing.
So we're not against using these manual techniques or rubbing or any of that. Like, you can still use the massage, you can still use the tools. However, that alone is not going to change what's happened to the tendon. You have to load it. You have to do stretches and exercises and loading in order to heal. You have to move. You have to do your own work. Like, I'm sorry.
Yeah, unfortunately. Something that Jen and I always talk about, and something that was supported in the research, is that if you have stronger external rotation and shoulder abductors, which is bringing your arm out to the side like you're gonna, do a snow angel or something. Snow angel. If you have a stronger shoulder and those supporting shoulder muscles, you might have less of a risk of developing something like this, or actually that those were weaker in people that were presenting with tennis elbow.
And so that's part of the treatment. As Don was saying, look at the areas above and below that area. Like the elbow is usually the middle guy who's getting overused because sometimes we're not using the shoulder very well, or we're not having the full mobility within the wrist. And so we've talked about wrist mobility on a podcast before. We've talked about shoulder pain, rotator cuff injury. And if you go listen to those 2 episodes and then start to say, oh, where am I lacking strength or mobility above and below, it's only going to help as you're working on the eccentrics and the other exercises at the wrist as well. Or, I mean, at the elbow.
Totally. And like through the fingers all the way, into the upper back. Like how are we extending and rotating through our upper back? Like go a couple joints.
Wait, you're telling me it's all connected?
Something like that. I'm no doctor. If we're not pressing through the fingers even when we're doing our wrist stuff, that's a big thing with people who do push-ups or do a lot of work on their hands. We're just totally using the bulk, through our wrist and elbow rather than actually activating into our finger flexors, finger extensors. Those can go a long way as to figuring out why we're putting more pressure through that extensor mass.
Root cause. We don't want to just do the eccentric exercises because that's what the research says, but not go back to, okay, well, what's happening at those fingers? How am I loading it? How's that wrist moving? How's that shoulder moving? We have to be looking at the entire picture if you want to truly get better. And hopefully, even if you're not having tennis elbow, you don't want to develop it. Maybe you like to play tennis. Maybe you like to play, the piano and stuff like that. You don't want to develop it. So do these exercises, address the wrist, address the shoulder, and work your body. Thanks so much for joining us on another PT Pearl from the Optimal Body podcast. I hope that you're continuing to learn a lot. If you have more questions, drop them below. If you're like, oh my gosh, I didn't realize a lot of the things that you're talking about, let us know. See what you're opening up to, what you're learning. We love to hear from you.